Hi, good morning. I just want to double check. Are you able to hear me okay?
Yep, perfect.
Great. Well, I want to say first and foremost, thank you so much for being here today. I know you have a lot on your plate, and your schedule is pretty busy. So I just wanted to give credit to you and say thank you for showing up and being here today. I really appreciate that.
Of course, you too. Thank you.
Yeah, so I remember in our last session, just to kind of recap, we did go over how you were feeling. I remember, just to recall, you were talking about that transition from high school to college. You're also working full time to support your father, who you are caring for, who is currently on dialysis. And then you're also going to college. Is that correct?
Yes,
Yeah. So it sounds like you really have a lot going on here. And I just want to, again, just give credit to you for just doing all those things. And before we ended our last session, I recall that I asked if there's one thing that you would like to benefit from services or if there's one thing that you'd be willing to fix. Do you remember me asking that?
yeah, I do.
Perfect, perfect. And were you able to identify one thing that you'd be wanting to change?
Yeah, I would say just the amount of guilt I've been feeling, having to take care of my family and do school as well.
Yeah, and I totally understand that can be really challenging, having to, you know, you want to have a good academic career, but also take care of your dad right now. So I understand that you are going through a lot, and I do recognize that. So I'm here today to meet with you to design a treatment plan. Does that sound okay with you?
Perfect.
Okay. And if at any time you feel uncomfortable, just let me know. Okay.
All right.
So I just wanted to introduce this treatment plan. And kind of as a disclaimer, I wanted to let you know that this treatment plan is designed to help you over a period of time. So it's not meant to be a quick fix. Is that something that you're agreeable to?
Yeah, it sounds fine.
Okay. Okay, great. Um, so just to kind of address that feeling, that sense of guilt, one goal or treatment goal that I do have for you is I want you to when you're feeling these feelings of guilt, I want you to practice positive self-talk. I know that you do have a lot of strengths. You go to school. I know last time we spoke, you said you were good at drawing, which is awesome. Are there any strengths that you are willing to share with me today?
I'm caring. I'm a good person. I'm ambitious, among other things.
Yeah, and I can definitely see that you're a caring person as you're caregiving for your dad right now. And I can see that ambition because, you are pursuing an academic career. And those are all really positive qualities. Moving into our second treatment plan is I want you to kind of reframe these thoughts. So, this is something that we call automatic thoughts. And I believe that you're experiencing automatic thoughts in the sense of, for example, because we talked about how your academic um, success has kind of been burden a little bit just because you are taking care of your father. And I know that, and correct me if I'm wrong, do you feel a sense that your grades are slipping because you are failing? Is that where the guilt is coming from?
Yeah, exactly. It's hard to do both.
Okay. Yeah, and I just wanted you to kind of reframe those thoughts and understand that there are some external factors here that are playing a part into your academic career. And then I want you to know that, this is not your fault because you do have, these external factors such as, your dad requiring extensive care right now. So I wanted you to kind of recognize that to kind of reduce those feelings of guilt. So just to kind of recap, before we end today's session, I would like you to identify at least three positive things about yourself, just to kind of reduce these feelings of guilt. And then also, I wanted you to practice reframing your thoughts. So, how can we, readjust our thoughts and how we think about ourselves and kind of analyze, okay, what's going on in my life? What are things that are out of my control, to kind of release that sense of guilt that you're feeling. Does that sound okay?
Perfect.
Okay. So I know that we are kind of running into a time crunch right now, but I just wanted to let you know that I want you to kind of practice that positive self talk, so that we can kind of reframe those automatic thoughts that you're having, to kind of reduce those maladaptive thoughts. Does that sound okay?
Yeah, sounds perfect.
Okay, awesome. And before we end today's session, is there anything that you would like to share with me?
No, besides, thank you for your time.
Of course, likewise. I hope to see you in next session and have a great day.
You as well. Thank you.
Thank you. Bye.